Good morning, good afternoon, good evening, everybody, and welcome to the launch of PEOF Plus Africa, and our very first pilot session from participation to partnership. It's a real pleasure to introduce you to this session. Last year, a couple of us at the PEOF event realized that there's no one size fits all for Africa. And there was a need for a platform that would bring together patient advocates and stakeholders to co-create solutions and reform policy and really make sure that any kind of patient engagement actually reflects the peculiarity of our amazing continent. And thanks to PEOF and the synergists, here we are today with our very, very first pilot session. It's going to be very, very interactive. It's going to be really exciting. We're really delighted to have you joining us here. We can see that people are joining us from all over the world and all over Africa. I'll be checking the chat shortly. My name is Abigail Simon Hart, and I'm a breast cancer survivor and the co-founder of the Bracon Foundation. And I'm going to be co-chairing with Hussein Jeffrey, who is the CEO of World Patient Alliance, which is the largest patient umbrella for patient organization that cuts across many, many diseases. You can see from the welcome slide that we have tried to put a few languages there. Forgive us if your language is not there, but you're very, very welcome. We can see people joining us from Uganda, from Kenya, from Nigeria. And please continue to put in the chat where you're joining us from and also which stakeholder group that you represent, because this is really for all of us, not just for patients, but for all stakeholders as well. Oh, we have somebody from Tanzania. You're very, very welcome. So we encourage you, please keep letting us know where you're joining us from. It's going to be a very, very wonderful session. And we're glad to see that we're really going across the continent. Next slide, please. One thing that's really good is that we are making as much provision as possible to ensure that if you don't speak English, that you do have an opportunity to have your own language. So there is an AI tool. If you check in the chat, you will see a link. Please click on the link and select your language and follow the instructions. So this should make it easier for those who do not speak English and require another language. Next slide, thank you. So what's really important and what's wonderful about PEOF events is that it is a safe space. You're free of judgment. There's no such thing as a stupid question or stupid comment. And you can rest assured that nothing will be attributed to you unless you've given us your permission. So you're free to put your questions, your comments, and feel free to give us your feedback. It's really important because this is about us. It is not us trying to force feed anybody. It's about creating a platform for all of us to work together. We ask that you are present and engaged. And for this reason, all your microphones are going to be on mute so that we can really focus on what we're doing. It's important to note that we are recording this session, and this is mainly for note-taking purposes. You can turn off your camera if you're more comfortable doing so, but we will ask that when I finish the housekeeping rules that you put your cameras on so you can do a quick group photograph. It's really good to capture the moment. And then much later on, you can actually decide to switch off your camera if you're more comfortable that way, or of course, if you're in Africa, obviously your data may not be strong enough or your bandwidth may not be strong enough, but it really is interactive. We really want to encourage you that this is an interactive session. So please give your feedback. And when it comes to the co-creation session, participate, and let's really co-create together. So can I just ask that everybody puts on their cameras because we're hoping to take a group photograph. So please, if we can all put our cameras on, and so we can, if you can put a camera, because I can see from the comments, some people's cameras are not working, but if you do have a camera that's working, please please put on your camera so we can do a group photograph. So we have some people from London joining us. We have some people from Malawi. Oh, wow, we've got Kenya. We've got Egypt. No, it's fantastic. We really have a really good coverage. And that's exactly what we want. We really want lots and lots of people. How are we doing on the group photograph? Ozzy, are we doing well on do we have enough people for the group photograph? Do we have cameras on?
Diego, can you confirm that we have taken photographs?
Maybe we should also cheese or something. Or PEOF.
It's all good.
Yeah.
It's all good.
It's all good? Okay.
We've got okay, fantastic.
But it was to make you smile more.
Oh, fantastic. So welcome, welcome, welcome. So let's move on to the next slide. So at this point, I'm going to hand over to Ozioma, and what she's going to do, she's going to take us through what PEOF is all about and what PEOF Plus is, because we don't want to assume that everybody knows about PEOF. So over to you, Ozi, to let us know about PEOF and PEOF Plus.
Thank you, Abigail. Hello, everyone, and welcome to this session. My name is Ozioma, and I am a program manager for the Synergist. I'll be walking you through what PEOF means, the difference between PEOF and PEOF Plus, so that you have a better understanding of why we are here. So PEOF is the acronym for the Patient Engagement Open Forum, and it's the only multi-stakeholder event for shaping the future of patient engagement. And it exists in two formats. We have the in-person events and the virtual events. And these events bring together diverse stakeholders to co-create solutions for patient engagement. Now, PEOF Plus is an extension of PEOF, and the difference is that PEOF Plus is community specific. And when we say community specific, we are talking about it could be specific to a geographic location or a disease area. And the essence of this kind of specificity is that we bring community leaders around such topics or locations to empower each other and to co-create together. Now, one other interesting aspect of PEOF Plus is that it connects communities with the global patient engagement ecosystem by bringing together, specific strategies from the local areas and making them inform or enhance the global strategies. We also invite the patient engagement community leaders to the Global Patient Engagement Open Forum event, the in-person events, and there they can get some ad hoc training. We also leverage the global collective intelligence and best practices and bring them to the local areas for them to implement in their specific contexts. And one of the very important events that we have at PEOF is the Made with Patients Awards. And this is an annual award that recognizes and celebrates people and projects that advance patient engagement globally. We've had so far about 6 awardees and finalists from the African community, and we wanted to take a moment during the session to congratulate them and thank them for their dedication and commitment to advancing patient engagement on the continent. I will now hand over to Abigail to walk us through the objectives and the agenda of the session. Thank you all once again for joining us.
Okay, so before I walk you through the objectives, I would really want you to meet the amazing PEOF Africa Pioneer team. These are people who are busy, who have all taken out time to join us to really make this happen. So Bahija Grimi, who is from Morocco, and she's with Amal. She's a leukemia survivor, and so she's representing Morocco. I'm from Nigeria, and then we have Eleanor Nwadi Nobi, who is from the Medical Women's International Association from Nigeria as well. From Kenya, we have Rachel Ogolo from Eczema Society of Kenya. We've got Egypt represented by Gada Ibrahim from UPATI, Switzerland, and Patient Advocates for Cancer Research and Treatment. We've got my co-chair, Hussein Jaffrey, representing Pakistan and World Patient Alliance. We've got Regina Kamoga, who is representing Uganda and Community Health and Information Network. We've got Jamie White from the US, Innovative Health and Science Strategies. Neka Nwokolo, also Nigeria, from Viv Healthcare. Fatima Awal from Nigeria as well, who's a researcher with King's College London. We cannot forget our Ghanaian sister, Vanessa Appiah from Accra London Health Centre. And then we've got our amazing Synergist PEOF team, who without them, this wouldn't have been possible. So a massive thank you to Ozi Ozudinma of the Synergist, who represents Nigeria as well. And of course, Eleonora Barilla, who is also representing the Synergist. A massive thank you. Without them, this wouldn't have been possible. They've been very patient with us, and they've been rooting for us, and we're really grateful to them. Next slide. So I'll quickly walk you through the objectives. We already introduced the fact that it's a pilot. We want to highlight successful patient engagement models and best practices from Africa. We are ultimately going to co-create a definition for patient engagement for Africa. You'll find out later from Hussein that there's various definitions. We want one that's Africa-centric, that's really tailored, that you will help us to create. We're going to identify common challenges and barriers to patient engagement in Africa. And then we want to prioritize what are the opportunities for collaboration that we have. Next slide. It's a very packed schedule. We have only 1 hour and 30 minutes, and we've already chopped 1 hour and 18 minutes. So we're going to have a 25-minute panel discussion where we'll be listening to regional champions, and they'll be telling us about how the current landscape looks in their own environments, what are the keys, gaps that need to be addressed, and some of their success stories. We'll then have a 40-minute co-creation session where we'll go into breakout groups, and we'll move from that very general definition that Hussein's going to give us to your definition, to what does PE actually mean? What does patient engagement mean to you? And what does it mean in your region? Because it may vary by regions. And then we're going to now talk about what are the key challenges that we're facing, that you are facing, and what are the real opportunities for patient engagement. And then we'll come back for 20 minutes, where we'll now get feedback from the moderators in the breakout rooms, and then we'll now talk about the next step. So it's really packed, but we really want you to be engaged and get involved, please. Next slide. At this point, I'm going to hand over to Hussein, who is going to take you through the generalized definition of patient engagement, and then he'll also lead us through the panel discussion. Thank you very much. Over to you, Hussein.
Thank you very much, Abigail. It's a pleasure to be here. Hello, everybody. So we're talking about patient engagement, and we all hear about it, but we might have different understanding of what actually patient engagement is. So patient engagement is more than simply informing patients or asking for their feedback once healthcare decisions have already been made. It means involving patients as active partners in their shaping the healthcare, the policy, and the services. As this slide shows, while different organizations use different language, and they all point at the same kind of core idea, and that is patients should not be passive recipient of care, but respected contributors whose experience, perspective, and priorities help guide healthcare decisions. So I would explain it through the 5 key elements of patient engagement highlighted by different organizations on this slide. So firstly, let's talk about collaboration. Patient engagement means that patients work alongside healthcare providers, policymakers, and other stakeholders to setting priorities, designing solutions, and sharing knowledge. It's a partnership, a two-way stream, not a one-way conversation. Then secondly, patients are active, valued, and valuable. Patients bring lived experiences that professionals and institutions cannot replace. Their insights help make healthcare and research more relevant, practical, and responsive to real needs. Then thirdly, it includes patients and carers. So engagement is not only about patients alone. In many contexts, including our context in Africa, carers and families also play a very central role in treatment, support, and decision-making. So their voices matter too. Then fourthly, it must be intentional and meaningful. So true engagement does not happen by accident. It requires creating real opportunities for dialogue, mutual learning, and shared influence. If patients are present but cannot shape the outcome, that is participation in name only, not meaningful engagement. And then fifth, it's about facilitating and strengthening the role of patients as co-producers of health. So this means patients help shape not only their own care, but also the systems, the policies, the practices that affect communities more broadly. So for me, patient engagements means creating a healthcare culture where patients are listened to, respected, and involved as equal partners in decisions that affect their lives. And it's about moving from participation to partnership. And in our African context, this also means asking how engagement can reflect our realities, our communities, and our health system. So can we go to the next slide, please? So let's have a panel discussion and learn about from our regional champions on what patient engagement actually looks like in Africa. We will explore challenges and opportunities and see how we can all work together to improve the situation in the African continent. So let me first introduce Regina Kamoga. She is the Executive Director for Community Health and Information Network Chain from Uganda, an organization that promotes, and working with people with HIV and non-communicable diseases. She is also a founding director of the World Patient Alliance and also heads the WPA's African Regional Steering Committee with more than 220 member patient organizations in the African region. Regina has very recently been given a very award. It's called Trailblazer in antimicrobial resistance in 2025. And Regina is also our WHO Patient Safety Champion. Then we have Bahija Gurumi. Bahija is the president and founder of the Amal Foundation organization based in Marrakesh, Morocco. Bahija is the steering committee advisor of the CML Advocates Network. And moreover, she is also the academic committee member of the University Diploma Patient Partners in Oncology at the Faculty of Medicine's Muhammad VI in Casablanca. And then we have Dr. Kemi Ogunyemi. Dr. Kemi is the special advisor to the Lagos State Governor on Health in Nigeria. She served as a commissioner at the Lagos State Health Service Commission from 2015 to 2023. Dr. Kemi holds a nursing degree along with a doctorate in healthcare administration. In the ministry, she oversees functions of the departments of family health and nutrition, pharmacy, nursing, ambulance services, FEMA, and medical administration and training. So I welcome all the participants and all the panelists to our discussion today. And before we start our discussion, so for all the attendees of this webinar today, you can ask questions to the panelists, and these questions, you can put them into the chat box, and these will be answered later in the webinar. So let's start with the panel discussion. So I'll start with Regina. So Regina, from your experience in Uganda and similar settings, what does meaningful engagement, patient engagement look like in practice at community? Can you share a concrete example?
Thank you very much, Hussein. Patient engagement in practical terms is, first of all, recognizing the value of the patients, their lived experiences, their perspectives as valuable to the healthcare processes. And it's really about recognizing them as partners, not as just passive receiver of care. And it's important they're involved right from the beginning to the end, what we call these days through the co-creation process, because they have the lived experiences. They know the practical realities at the last mile patient. So their involvement right from the beginning informs and gives us targeted interventions. And this involves having them not just sitting on advisory groups, but about contributing and their perspectives being taken into account when designing guidelines and other strategic documents. In Uganda, we have the Uganda Alliance of Patient Organizations, where we bring together patients across different disease areas, and I'm very glad that Kenneth is here today. He's part of the network. Patient engagement has been, I can say, successful largely because members of this Uganda Alliance of Patient Organizations have been involved in joint work, being empowered to advocate at the highest level, and many of our members sit on high-level advisory groups, research ethics committees, community advisory boards, and their input has informed quite a number of interventions and made changes at the highest level, that is the Ministry of Health. Kenneth sits on advisory groups on hepatitis, and his advocacy has actually led to the increase of the hepatitis budget. Then we have the Sickle Cell Association in Uganda, which has also been part of the many processes that have seen studies on sickle cell being done. And at the moment, we have a national passport for sickle cell that has resulted through the engagement of the patient organizations together with the Ministry of Health. Furthermore, a budget has been put in place for sickle cell And right now we have sickle cell screening for newborn babies, and as well as screening for hepatitis B for newborns. And that has been a result of patient engagement with the patient organizations who have been empowered to advocate and be part of these high level technical working groups and designing strategic documents, guidelines, and others. So for us, it's not really about parachuting to the patient space. It's about building trust, and trust takes a long time. So it's not a one-off. For us to have a relationship where we are respected, our views are respected and incorporated into the process.
Okay, so thank you, Regina. Now I will ask Bahija. So what is the current landscape of patient empowerment in Morocco? And where do you see the biggest gaps in moving from participation to partnership? Bahija.
Hi, Hussein, and hi, everyone. I'm really happy and excited to be part of the PEOF Plus Africa team and participate in this webinar. To answer your question, patient engagement in Morocco is progressing with the growing recognition that patients bring essential expertise to healthcare. Patient organizations are more active and national conversations have begun. But what we see today is mostly patient support, advocacy, prevention, and our awareness, which are really important pillars, but not yet full engagement. And I believe that patient engagement remains mostly consultative, but not yet a true partnership. And the key gaps include the lack of understanding of what patient engagement truly means. It's collaborating with patients, not for them. And we still lack mechanism for patients to participate in governance. We still lack structures that allow patients to participate in decision makings, research, and ethic committees. We have some initiative, but not enough, and we don't have. We still lack that patients participate in health technology assessment. And yes, patients are sometimes invited to discussion, to congresses, to meeting, but without real influence. And we have also limited training for patient partners, but also limited training for professionals. And we still have limited funding for sustainable engagement initiatives. I believe that, moving from participation to partnership requires structured and permanent and transparent mechanism that integrates patient into policy design and health strategies and research and system transformation. This is how we can transform this participation to a real and true partnership.
Right, thank you. So I'll get back to Regina. So Regina, what are the two top barriers you have identified in your work? So Bahija talked about some barriers, but what are the two barriers that you have identified in your work that limit meaningful patient engagement at the community level, and how do they affect patients' participation? Regina? You're mute, Regina. You're mute.
Thank you, Hussein. One of the most top barrier is the lack of the low health literacy. The low health literacy is when patients are unable to understand, process, and act upon health aspects. And this impacts their level of engagement in terms of making informed decisions, navigating the healthcare system, and being confident enough to be able to participate at an equal level and openly make contribution. This is a huge barrier. And I'll give an example because we're talking about patients being able to make input into processes such as the research protocols, guidelines, and others, clinical trial processes. But if they have low health literacy, this is not possible. So this has really impacted their involvement, their engagement. The other one is about the lack of trust. And the lack of trust is based on past experiences where patients have been disrespected, where they've been looked at as passive receivers of care and not like equal partners, where they've had to be able to not valued as partners and just as rubber stamps parachuting into their spaces and not allowing them to, making them feel like just passive receivers of care, but not people with a mind that can make useful contributions. And this lack of trust, because we know that trust is built over time. So the lack of trust is actually a deal breaker. And this has impacted patient engagement in a very big way.
Right. Thanks, Regina. That's very helpful. So, Bahija, coming back to you, can you share a successful example of patient engagement in Morocco or in Africa elsewhere that we can learn from, and what made it effective?
Yes, Morocco has examples that demonstrate progress toward meaningful patient engagement. And the first example is the patient partner university degree, a pioneering program in Africa. And we are very proud that Morocco launched this for the first time in Africa, this degree. And it was launched at the Mohammed VI University of Medicine in 2021 to train patients as knowledgeable partners in health system. And I'm very proud to be graduated of this program, which has reinforced my capacity to engage as a true partner with a healthcare system in Morocco. And the second one, in 2024, we had a historic meeting with the Minister of Health and WHO representative and cancer patient organizations. And I saw Hiba Sawahli from WHO EMRO region present in this webinar. And I'm very happy because she launched this amazing and historic meeting with us, and to discuss meaningful patient engagement in alignment with the global WHO initiative launched in 2023. And we had, for the first time, the opportunity to open, a direct dialogue of patients' needs and to recognize patients that, as partners rather than beneficiaries. And the third example, the creation of the Moroccan Cancer Patient Alliance in last February, and this alliance will be an important step toward stronger and unified patient voices to enable coordinated advocacy and structured collaboration with decision makers. And finally, Dar al-Amal facility built and managed by our organization Amal is a powerful example of patient-led innovation. And this facility and Dar al-Amal is designed by patients to support cancer patients and families traveling long distance for cancer care. And this example, it shows how local solution can emerge directly from patient needs. And I think that we are really blessed, because Africa has the creativity, resilience, and determination to shape its own, model of patient engagement. You can see, instead of waiting, we innovate, and instead of being excluded, we create solutions. And now maybe it's time to align our vision and to build patient engagement as a system, not as an exception for all patients in our region.
Okay. Thank you, Bahija. Excellent example. And I think I would love to hear more on your university program, but I think that we can discuss later. I'll ask another question to Regina. So Regina, what are the key benefits of meaningful patient engagement?
Yeah, thank you, Sen. Okay, of course, generally, when there's patient engagement, we will definitely have improved healthcare outcomes because the needs of the patients have been considered and the interventions are designed to meet exactly the needs of the patient. The other is, of course, having them in the processes. This ensures that we have more, again, relevant problems because there's the co-creation process, which involves the patients themselves. And they're the ones with the lived experience. They're the ones who understand, like I said, the real practical realities. And once these are incorporated into these processes, then the benefits will definitely result into better programs. And of course, there will be increased stigma and discrimination, trust, which is built. And we know that once there's trust that is built, then of course the collaborations are going to be mutual and they will definitely be sustained and have long-term impacts. Thank you.
Right, thanks. So, Bahija, we've just heard from Regina about the benefits of meaningful patient engagement, but how can we demonstrate the value of patient engagement to decision makers to make it a reality?
I think today collaboration with patient is not optional. It's something is essential, and patient engagement has become a core expectation across healthcare systems worldwide. So to make maybe patient engagement a standard practice, a reality, we need to demonstrate its value in ways that resonate and speak directly with decision makers. First, I think through better health outcomes and community impact. When patients are involved in designing programs and services, those programs are more relevant and adherence improves and outcomes are stronger because community benefits from solutions that truly meets their needs. And the second is through efficiency and smarter use of resources, because co-created solutions reduce waste and avoid poorly adapted interventions and ensure better use of limited resource, and this is critical to save money. And for health system facing financial pressure, this is a powerful argument, and we should use this to participate and to be more efficient. And the third, by combining evidence with lived experience, because data such as patient-reported outcomes, case studies, or real-world examples of successful collaboration are essential and helps helps show the measurable impact of engagement. But data alone is not enough, because human stories bring meaning and urgency to this number. It's not just a number, but it's something about lived experience. And when we combine measurable results with authentic and real patients' experiences, the value of engagement becomes clear, visible, and credible, but also impossible to ignore.
Thanks a lot, Bahija and Regina. So as we bring this panel discussion to close, several important points stand out. Patient engagement in Africa is advancing, but we still have some distance to travel. And before it becomes true partnership rather than occasional partnership. We have heard that today that the barriers are significant, but we've also heard the encouraging examples of what works at community, strategic, and system levels as well. The main challenges before us is now to move beyond these isolated efforts and make patient engagement more meaningful, measurable, and embedded in the way health systems operate. That requires trust, collaboration, and political will, and a clear demonstration of value. So I will once again like to thank our distinguished panelists for their thoughtful contribution. So let this conversation be a step forward, a step stronger towards more inclusive and more sustainable patient engagement across Africa. And as I mentioned earlier about if you have any questions, please put them in the chat, and we will be answering these questions after the next session, which is on co-creation. So as we move on to our next part of the session, which is a co-creation exercise from general tailored definitions. So what does patient engagement mean in Africa? So in this session, all of us will work in groups to reflect on patient engagement and its challenges and opportunities in African context. So this is our chance to turn discussion into shared ideas and practical input. I will now hand it over to Oziama to take us through the group work process. Over to you, Oziama.
Thanks, Hussein. Now that we've heard from all the panelists, we now want to hear from you, the audience. We will be splitting into breakout groups soon, and we will be using a tool called Group Map to take notes. So we invite everyone to please feel free to use this tool to share your ideas by writing, or if you prefer to speak up, you're also free to do so. My colleague must have shared the link in the chat, so you just need to sign in and you would have access to the tool. So this co-creation aspect of this session will be focusing on 3 themes. So we will have 3 groups. One group will focus on co-creating a definition for patient engagement in Africa. Another would be to identify the common challenges and barriers to patient engagement in Africa. And then group 3 will focus on identifying opportunities for collaboration to strengthen patient engagement in our health reform processes. So we have 3 amazing moderators who will be guiding the discussion today. We have Gada Ibrahim from UPATI, Switzerland, and patient advocates for cancer research and treatment, Rachel Ogola from the Eczema Society of Kenya, and Eleanor Nwadinobi from the Medical Women's International Association. So I will allow my colleague Matt to please move us into the different breakout rooms where we can continue the conversation.
So I will both say the question out loud and then I will write it to you if it's easier like this. So these are general questions. We got 4 of them so far. The first one is, from the perspective of organizations like the Congolese Vitiligo Association, ACV, how does PEOF Plus Africa plan to move from consultation to meaningful co-decision, ensuring that local patient groups are actively involved in shaping policies and programs?
I think we already answered, when Hussein asked us, if you remember, about being visible, and I remember that Regina talked about trust, about how to be involved. We have to speak the language of the decision makers. We have to be present. We have to. I remember when I start by advocacy, by activity, by prevention, just to be visible, just to have visibility, and allow the health professional, the health care system to see you and to be visible. I start to speak with media and to show our activities. And this is something very good in Africa, to be visible and to show the activities and to show also the capacity, because we have a lot of organizations, but not, knowledgeable partner enough to be involved in such, for example, decision-making process. What do you think?
I'm wondering, I think my interpretation of the question is that what are we doing to give people like a roadmap to move? So I think it's more of a case of ultimately, maybe it's a case of putting some of the examples like yours of how you've gone about to create tools, how you've gone about making impact in your own country into like a toolkit or some sort of roadmap or some sort of guide, so that they can now use that in their own environment or adapt it to their own environment. Do you know what I'm saying? That's the impression I get, because it says that how do you plan to move from consultation to meaningful co-decision, ensuring that local groups are actively involved in shaping policies and programs. So it sounds almost like, what assistance are we giving as a platform to encourage people, to give people guidelines to be able to deal with, become co-creators in their own environment. So maybe that's what it is, that we ultimately, through all these our discussions, we create like a roadmap or a plan or something that can be adapted to each particular environment. I don't know if you're in agreement.
Yes, Abigail, I think this webinar is the first step. We are here to understand the patient engagement first before moving on and before doing activity or programs or something else. The first thing is to understand what patient engagement means to patient organization. And also, in Africa, maybe we are in an early stage, but it's good to work together, to have some, a common model to develop this patient engagement according to our setting and the African context. What do you think?
Yeah, I think we're all saying the same. I think we're saying the same thing, where we're saying that clearly we need to have a uniform, not uniform, but a definition that applies to our different contexts, a loose definition, and then ultimately we can create like a loose template that again people can adapt based on their own experience. Because really what we're trying to do is capture the experience of the entire continent and look at it and say, okay, look, what do we have in common? What do we have different? And how can we now try and bring the gaps together? And how do we ensure that in trying to create a common thing, we're not losing out because some African countries are in different stages of development or their needs are different. So what we're actually trying to achieve is extremely ambitious, really, if you think about it.
I'm wondering, I'm wondering how to, someone is taking note, or Diogo, for example, you are taking note to answer this question, because we said a lot, but I can't remember.
I think empowerment in this case is also very critical, because I know that there are also, like the challenges, the barriers, and as PEOF, how can we build the capacities of these patient organizations to enable them effectively participate actively? So the whole issue of empowerment is very critical in this. And how are we going to do it?
I think the good thing is, because of PEOF Plus Africa has access to global, it means that there's visibility. And what often happens, like our foundation, nobody really cared until we started winning awards and things internationally. So I think that's a good thing about PEOF Africa, is the fact that we're taking local communities and giving them a global stage. And it's that visibility that gives the empowerment. It's that visibility that makes the government think, okay, this person actually was recognized in this international thing, so they must be talking sense. Do you know what I'm saying? So I think that's what we are doing as PEOF Plus Africa, is that we're giving local communities a global, an African, and first a regional platform, as well as a global platform that now empowers them. It helps them to articulate their own challenges, and we will help them to arrive at a solution that works for them. I think that more or less summarizes it, doesn't it?
I think also we can suggest, for example, to have some online education, because we need that. We need that people, that cancer organization know how, for example, to engage with media, how to be more visible in their country, because we are talking about Africa, but every country have its own specificity and problem and needs and so on, and we need to maybe to also to think about educate people and to give them tools to be able to be engaged with the decision makers in their country. I mean,
I can say Diego's hand is up. Diego.
Yeah, I would just ask maybe if we move on to the next question, because we still have around 5, I think. So
okay, I mean, have you taken notes of the other one though? Have you got it in a
yes.
nutshell? Okay, all right.
I am here doing a marathon. I've never written so fast in my life. I'm quite proud of myself.
Perfect. Okay, perfect. So next question then.
All right. So the next question is, I will first say it and then write it in the chat. It's by the same person. So considering the experience of the Congolese Vitiligo Association, ACV, working in a resource-limited setting, what concrete and sustainable mechanisms are being envisioned to support and strengthen local patient organizations across Africa? And let me write it here in the chat.
That sounds like almost the same question,
Yeah, I think
Yes.
in a different, but in a different
Yeah.
way. So it's just twisting the
Yeah.
same question a different way to ask now the mechanisms. Before
Mm.
he was saying, what are we doing to support? Now he's asking what mechanisms. So in my opinion, it's the same question.
The same.
We can move on to the next one if you want.
yeah.
Yes,
Yeah, I think so.
Okay. I think his next question was very similar. I can read it out, but it's shorter. So how can organizations like the Congolese, the ACV, be meaningfully involved in defining and measuring the impact of patient engagements to ensure that outcomes truly reflect community realities? I would say this one is more about metrics. So what can we measure? What is success, maybe, is my interpretation. We'll write it in the chat. There you go.
I think we have to take into consideration, that it's not enough to know that patient engagement exists, but it's a process. We have to work. We have to be to be present in discussions, and we have to be more visible. As I said before, maybe it's not only. If I know what patient engagement means, I will be engaged, or I will participate, or the decision maker will ask me, will invite me, and so on. It's a long process, and it's not easy. We have to know our specific patient needs, and also to work hard. It's not easy. It's advocacy every day, and we have our job commitment, full-time job, and our family, commitments, and so on. And we are patient advocates. What we did to be engaged with, we have to speak the language. We have to speak their language, and we have to also to show some data, some activities, to be more visible. This is why I am talking about visibility. It's something very good, but also we have to have the right knowledge to engage with the policymakers. I don't know, what do you think?
Dr. Kemi, welcome. Did you want to add something?
Yes.
Or
No,
please go
Yes,
ahead.
I just want to
Welcome.
add something. Yeah, I've been listening for a few minutes. Sorry, I came in late. I have to leave another meeting. So yeah, very interesting, and I agree with what Bahija said. I got that right, yeah?
Yes,
So
Bahija.
for me, for me, my own experience is all about giving patient-focused care. And she's very right that you need to know, what do you mean by patient engagement? And for me, patient engagement is between 2 people or 3 people or 4 people. In other words, giving them ample opportunity to be able to ask questions. And so one of the things they did in Nigeria that we did was the Patient's Bill of Rights. So educating the patient that you have a right to know about this, you have a right to ask questions, because in Africa, well, let me just say Nigeria, the culture really is that it's a medical, the medical team are the ones in charge of you. You came there, they're the ones that know everything, you cannot question. And it's something that still exists right now. It's just a culture of where the patient is afraid to ask the doctor a question, and then leaves the patient leaves the doctor and then asks the nurse, or says, and then the nurse says, why didn't you ask while you were in there, and so on and so forth. So what we tried to do, and I use the word tried, and we're still trying, is when the Patient Bill of Rights came out, it said you have a right. You have a right to ask this question. You have a right to refuse treatment. And that is why people sign consent. Before you sign a consent, you have to tell the person, blah, 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 blah. This is what may happen. Do you want or do you not? So the patient has a choice. And then we also have civil society organizations that work on behalf of patients. So that's the first step for us. The second step is actually telling the staff that's the doctor, the nurses, the patient, the pharmacist, and all who are involved in the patient care, that you have to answer these questions. You're not the boss of the patient. The patient doesn't want to be there, but the patient has come to you and is actually paying for your services. So what do you understand? You're a doctor, you're a nurse. What do you understand by ensuring that the patient is engaged in their care and that the patient can actually make a decision on their care? If they don't understand that, the patient will never win, because it's a two-way thing. That's my own opinion, and that's how we've been operating. Secondly, how do you measure that? Research has shown that when patients are involved in their care, the decision is made with the doctor. They understand exactly what it is, and they've gone together with the family members sometimes to make a decision. They actually do better. The outcome is usually better because they know they have that control. They can say, no, I do not want this treatment. Now, going back to the doctors and the staff, the doctors and nurses, patients do they get too much information, and that's where Dr. Google is their friend. So as Africans or as Nigerians, some doctors may feel the patient is asking them too many questions, is questioning the plan of care. So you have to train the doctors that don't look at it like that. The patient has a right to ask you the question, and you have an obligation to tell the patient. And so that's the premise in terms of patient-focused care. What does this patient want? What is good for A may not be good for B. So the patient, the doctor and the nurse cannot say, well, I've been doing this all my life and this is how I've been doing it. No, the patient doesn't want it done like that. So you engage them. And so what we also do in the community, especially the primary healthcare, the main community, is involve the leaders of those communities. So for example, simple example, we wanted to introduce HPV vaccination. First time round in Lagos, let me just say it was a flop. Second time, not that we didn't do much, it's because a lot of anti-vax people were there, but we involved the kings and the chiefs and the pastors and the civil society organizations, and we also partner with NGOs. They help to inform. They act as advocates. And so the patients become more engaged. And then we ask them questions. What do you really want in the community? And that is something that has worked and it is measured. When I was in America, even to choose, I work in oncology, cancer care, even to choose the chairs that the patients will sit down when they're getting the chemotherapy, it was dependent on what the patients wanted. So we had two patients who represented the other patients, and we had examples of the chairs that we had, because I'm not the one going to be lying down there getting my chemotherapy. It's the patient. So when you involve the patient and you engage them, this is what we want to do for you. What is best for you? So those are they sound theoretical. They are theoretical because it doesn't work all the time. So I'm not sitting here saying, oh, we've got it perfect or whatever. No, local content and the way and all the things we have to deal with, but they can be measured through how satisfied the patient is and how much they actually tell you what they want before you even say what you think they need. I just wanted to add that to it, but that's what engagement is. Engagement is not just one person. It's between the giver, the taker, or the taker, but usually in this environment for patients, it's the giver and the taker. I'm giving you this. Do you want it? But before I take it, I need you to tell me everything I need to know. And then I can turn around and say, no, I do not want it. I prefer to go through this. I prefer not to have chemotherapy. I prefer to have radiotherapy. So it's your choice. And as a provider, I can convince you by telling you my opinion if you want it. So both of us are going back and forth and we're following up. And so we're engaging in the conversation because it's all about that person's health. So
okay,
I've spoken too much.
So how, yeah, no worries. So how would you answer that question? How can an organization like the one that's on the chat, how can an organization, okay, like the Congolese Vitiligo Association, be meaningfully involved in defining and measuring the impact of patient engagement to ensure that outcomes truly reflect the community realities? That was a question that came to the panel. So how can
So I don't know, and I will confess, I do not know about the Congolese, whatever, but let's just say an organization that wants to measure the effects of
the impact of patient
engagement. The impact.
So
exactly. It's because
define and measuring the impact.
Yes, we're talking about the patient engagement. So it's a patient that's going to be able to tell us.
So you're talking about, would it be like surveys? Would it be surveys?
Yeah, you have to ask the patient. You have to ask the person who is engaging. How do you, and it's surveys, absolutely surveys, absolutely. And the survey has to be one of those surveys that it's not you answering it or whatever. Maybe immediately they've had their contact with the people, with the providers. You're providing, so the hospital, the clinic, the community, you're providing a service. The person comes in to you, the person leaves. How was that experience? And then the questions will be, how you ask the patient, did you feel you were heard? Did you feel you contributed? Did you feel you had a conversation? Were you engaged? Were you together? Were you on the same length? It's by surveys.
So we're talking about co-created surveys where you found out what the needs are in the community, and then
absolutely,
then you find out afterwards. Diego, are you getting this? Afterwards, whether it actually met the patients, the need or not, whether they felt that it met what they want, what they expected. So it's understanding what is wanted and was it delivered. So it's two sets.
Exactly, and it's only by surveys.
Okay.
Yeah, they have to be able to tell you that. So you have to create an environment where they're able to tell you that. And it's all about trust when it comes to Africa. It's, do I trust? Are they good? Are they, those are the issues where other developed countries may not necessarily even think about trust. So the person coming to you has to trust you. So, hello, look, we're trying to do this. We're trying to improve our patient engagement. We're trying to improve the way we relate. We're trying to improve your outcomes. What do you need from us as a health facility, as a government? How can we help you achieve that? What would you like to see? And then you take that, and then it's like you've done it. You think you've done it, you've trained your people, then you go back and say, how was that experience? And so when you measure in percentage form and you've asked all those questions, then you'll be able to tell that, oh, wow, look at what has happened. Our patients are coming more. Let me give you a very, very good example, is pregnant women going to the community birth attendants or unskilled birth attendants. One of the reasons, and that's research, by the way, evidence, one of the reasons why they do not want to come to the hospital is because of the way they are treated. It's not even just financial. It is the way they are treated. So by the time you do all the training and you're looking at them doing antenatal, whatever, and they do come, that is a measure of, oh, we now have an increase in the number of people that are coming to your orthodox hospitals, or there's a decrease in the people, or there's a decrease in your maternal deaths in the community. That's how you.
I can see that Diego's hand is up. I think we're fast running out of time.
Yeah.
And did you want to say something, Regina, quickly? Because I think we're fast running out of time.
Yeah. I was looking at it also at another level, at like maybe the patient organizations. And like, for instance, how many in terms of, it could be a policy that you have influenced through that patient engagement that can also be measured. For instance, like the examples I gave in Uganda, where sickle cell and hepatitis have been part of a process that is translated into having increased access to medicines, treatment for people with sickle cell and hepatitis, but also influencing policy and, in terms of guidelines that have incorporated the patient needs. That's what I want to.
So you have the immediates, the faster ones, which would be your surveys, and then you have the influencing policy that generally takes a bit longer, I think.
How many?
Over to you, Diego.
Yeah.
Okay. Thank you so much for this discussion. As I write, I'm finding it very interesting. I think the next question is very, very good. It's very short, and it is, what are some of the best ways for those of us based in Europe to support patient engagement in Africa responsibly and equitably? And I will write it in the chat.
What comes tongue in cheek, I say support platforms, sponsor platforms like PEOF Plus. Be a sponsor. Create, because everything boils down to having the funds to do anything in Africa. To get people to do any kind of research, any kind of anything, it involves money. So I would say it would be to sponsor through an organized structure, like PEOF Plus Africa, where ultimately it's open to everybody to join. What do you think, Bahija?
I think also involve our patients, recruitment of patients. When we have clinical trials, we don't have any patient from Africa, participating in clinical trials because no research, real research in Africa, and also partnerships and projects, maybe doing project together, and also learning from European side what maybe what's isn't working in Europe doesn't work in Africa, but also I'm talking about partnerships. I'm talking also about funding, supporting some patient engagement initiatives in Africa. But the major thing is to encourage and to participate. That's our patients from Africa participate in clinical trials
within the European environments, as in increase the capacity, or that's within the diaspora, or are you talking about actually flying patients over? Because a lot of the trials would be in Europe, not locally.
Now we have telemedicine. They can, for example, send the medication and then following via all these platforms and WhatsApp and so on and so on. Or maybe when I am talking about partnership, it's not only a civil society organization or patient organization, but also between hospitals, between oncologists or physicians or so on. I mean, partnerships in multiple levels, not only with us as a patient organization. We can drive research everywhere in Africa. Why not?
Yeah, but also, it's also trying to understand, engaging through a co-creation process and understanding the needs of those patients that they want to engage with, but also in not one-offs, but in like long-term relationship, building these relationships and building, trust so that they can have, sustainable partnerships.
Yeah, I love when you are talking, Regina, about trust. It's a very important point regarding patient engagement in Africa. Trust is something very important, and we need to build this trust both sides, from patient organization or patient advocates, and also from decision makers and physician and all healthcare professionals. I mean, we have to set this trust, and it's difficult sometimes to trust the system or to trust patients, because they are looking to us like activists and some who are doing troubles and so on. But we need just to help our community, and that's our patient thrive, not only survive. Thank you.
What happened to Diogo?
I'm here.
Yeah. Okay, I thought you disappeared.
No, I'm still here, just writing. I don't know if Dr. Kenny.
It's time to return to the main.
Yeah, I think.
Yeah,
Yeah,
because we
already.
still have 20 minutes.
Oh, we still
19
have
minutes
4
left.
minutes because I believe it was extended. So we still have 4 minutes.
Okay. Okay.
According to Matt. I would ask maybe Dr. Kemi if she wants to answer this latest question as well, because I think she is the only panelist left to answer this last one, if she's interested, of course.
Which one?
The
Okay.
one about
yeah.
Go ahead, Diego. Go ahead.
So it's what are some of the best ways for those of us based in Europe to support patient engagement in Africa responsibly and equitably? Oh, I think there's a bit of lag.
Go online. Sometimes I recommend organizations and just support those organizations because they're over there. And like Abigail said, it's all about funding sometimes. And also because of technology, a lot can be done online like we're doing now, and we're all in different parts of the world, of Africa. They can actually support not only financially, and when I say financially, they use that money for advocacy. Is to tell patients. If patients don't know, they can actually engage freely or express themselves. If they don't know about it, they're not going to do it. And so any survey you do will be a waste. So they can support through that. They can also support by advising. They can have webinars like this for those, let me say, the elite that have access to Zoom or whatever. They can be part of a webinar and give advice to those societies, and they can also just generally support whatever it is that organization wants to do for the patient, and they can of course support the hospital. So what a lot of people do in diaspora is try to find out what are your needs, and then that person who wants to support will choose which part that they can actually give. So that's how I'll answer that. That financial, yes. Giving advice and just supporting by teaching, by explaining certain things, by giving information that could help as well. Is also just as good. And usually those organizations welcome it. Yeah. Or the latest in anything that they're doing over there. So they just share. It's almost like benchmarking. What are you doing over there to improve patient engagement? And then they say, look, this is what we're doing. Why don't you try this? So that's how I'll say that. Financial as well as support by teaching.
Okay,
Is that okay?
perfect. Yes, I would say we're pretty much perfectly on the dot. We have 15 minutes left in the session globally.
Okay.
So
Okay. Wow. Okay.
yeah.
I think it was very ambitious what we were trying to do, and I think we've done pretty well. All things considering,
I
I
agree.
think we've done pretty well.
So I don't know
We're
if
going back to the main room. Breakout groups are
yes.
broken out yet.
Can I just say that, it's worth asking where we are now. When you want to do surveys and you want to see whether there's any impact in whatever you've done, it's probably worth finding out what is going on now. So you have a baseline to test or to assess the improved patient engagement. So it's worth asking patients right now, what do you understand about patient engagement? And then explaining it to them and say, do you think that is happening right now? How free are you to ask those questions? How much are you involved in your care? How do they answer your questions? Are they receptive to listen to what you have to say? And then that will give us, like, let's just say, 30% of patients are engaged. So by the time there's this new wave and this new way of doing things, and then you resurvey, you're hoping the 30% to be like 60%, 70%. One of the drawbacks in patient engagement, because it all sounds good, one of the drawbacks is the time. you have
Yeah.
for patient engagement. We don't have time. We don't, and it's not an African thing. Even in England, my daughter is a GP, and she said in her practice, they have limited time. They have a set time to spend with the patient. It's set. And once that time is up, it's almost like going to the therapist. It's like, in other words, the patient comes into you, you listen to the complaints, you do all the things, and you give the treatment. Don't sit down and keep on talking. And we know some patients would love to sit down with you for an hour and talk. So there's a way about that patient that is not just engagement. We're just going to sit down and have a chit chat continuously. I have other patients waiting, but there's got to be training on how to end it so that the person doesn't feel cut off and will reply you and tell you, I was not engaged. They did not allow me to say what I. So those are the challenges in patient engagement.
That's where tools come in, your WhatsApps, your messages, your SMSs, and things like that. Thank God there's some element of digitalization. Phones, there's a lot of new products that lose very low bandwidth.
Absolutely.
So,
absolutely.
And if the patients are empowered already and they feel empowered, then they're more likely to listen to what you're saying as well. So you probably need a little bit less time anyway.
Exactly.
But it looks like we're back on the main group. Thank you so much, everybody, for that. Thank you, Diogo. Welcome. I think we probably could have spent the whole day on this. I think it's been really, really engaging. I'm sure everybody has had a lot of debating to and fro we had a good time discussing the questions. I'd like to mention at this point in time, we will be putting the answers to the panelist questions in the chat for you. So we don't have a lot of time. I think we have about 12 minutes left, but I think we can comfortably go over by maybe 5 minutes if you can indulge us. So at this point, we're going to get some feedback from our different groups. And I'm going to ask at this point, Garda, to come back to us about, did you actually get round to getting a definition for patient engagement is the big question. How did you do with that, Garda? Are you there, Garda?
I'm awfully sorry. Yes, I was on mute.
No problem.
So thank you so much. We had a wonderful discussion. No, of course, as expected, I don't think we would have come up with a patient engagement definition. At this time, the idea is to keep working towards that, because as Hussein, showed earlier, the definitions are quite vast across the very big institutions and entities worldwide, across countries as well. So I don't know whether we are expected to reach a definition at all right now. We can work on that for sure, and I invite everybody to continue to do so with us.
Definitely.
But we did come up with a couple of things, including things that were said with the panel discussion and conversations we had in our breakout room. And the only thing I can say is that a lot of things surfaced. Patient engagement, again, is by definition a two-way process. So who are we engaging with? Are we engaging with community? Are we engaging with each other? Are we engaging in a multi-stakeholder space? But one thing's for sure is we've heard words that we all agree on, which is trust, inclusion, respect for expertise, respect for expectations by the different stakeholder groups. More so, of course, collaboration, partnership, and empowerment. So these are words that are basically we all agree on and that are the building blocks of how we can, in the future, build our own definition of patient engagement in Africa and in our context. So we don't have a final definition. The principles are surfacing, the valuable perspectives. These are all valuable perspectives. They will really shape this coming future work, but we will continue with these discussions with you. My question actually that came out is having a definition essential? Is it equally important to have the definition and to advance with concrete practical action? Is it important that we share best practice across the continent? Is it important that we collaborate with concrete examples across disease areas or across themes? How do we do so? Do we have to have a structure? Do we have to have a place where we can continue this discussion, probably both. So we will continue to address this question, but it will have to be hopefully centered in our local diversity and our realities while working towards multi-stakeholder dialogue and integration of patient engagement in healthcare. And we did talk about barriers, we did talk about best practice, but I know that you had the breakout sessions for that, so I leave you to that.
Fantastic. And I think you made a very, very valuable point. And I think what's important is we've got people thinking about what patient engagement means to them in their own context. So I think that's the wonderful thing about what we're doing now, is that we're giving everybody an opportunity to think about it, because when you start hearing other people's perspectives, things will come up that we didn't think about. And like you said, it is an ongoing process. And the valuable question is that how important at this stage is it? Is it just important that we recognize the fact that it has to be taken into consideration? And as we develop, as we said, in our own context, we now start saying, okay, look, is it actually possible to have a loose definition that applies across board? And then we now break it down into our individual contexts. And so I think definitely it's definitely something that is not a 40-minute session that's going to solve the problem. But I think what is wonderful is the fact that we've started talking about it now. Thank you so much, Gada, for that. Then I'll now go to group 2 with Rachel, who was talking about barriers and challenges. And these are likely to be very, very similar, I would imagine. So, Rachel, can you let us know how did you get on with the barriers and challenges?
Yeah. Thank you. There was a lot. We didn't have enough time. We would have gone on and on and on. Yeah, but the major issues that came up, we spoke about, we said that the materials available, we don't have enough material available for training, but also we can make use of the existing material to disseminate information. And then you also spoke about, a speaker also spoke about the emotional challenges faced by patients. So it becomes also difficult for patient engagement at that point. It is a challenge also there. And then the cultural barriers. How do doctors view patients? You know, do doctors, especially in our African setup, do doctors think that patients have the mental, not even the, like, you know, the understanding of what they go through, you know? So that is also a major challenge. And while at cultural barriers, we also spoke about cultural beliefs, rather. We also spoke about community dynamics and the patriarchy and gender roles and how they're affecting patients. You know, gender parity, women and children voices in Africa are less prioritized. It is men that make decisions on whether you should go to the hospital or not. Women are not taken seriously. Also, it is something that needs to be demystified, you know. And then we spoke about illiteracy. Illiteracy is also affecting patients. Yeah. And then, of course, we lack culture-friendly language in Africa to disseminate information, and that is causing a big gap, health literacy gap. So we need to choreograph information in a way that it is cultural-friendly for African intake. And then our poor healthcare and health facilities, and of course, poverty in it is affecting us as well. We need to work more with stakeholders. So that to have a community, this is our community. For there to be an impact, we have to work with stakeholders. And then there's need for robust media outreach, use of social media and mainstream media to disseminate information, because the problem we have is lack of information, and that has brought stigma. And stigma is the reason you know, there are problems here and there. So those are mostly the main issues that came up. I'm not sure whether I've left anything. Those are and of course, improving health systems and policies in Africa, and including patients in that. Yes,
that's fun. I think, and I think what we will find across Africa, these are likely to be common denominators across, especially because of Africa has so many languages. This cultural diversity is a huge thing, and definitely, again, we're all through Africa, you see the issue about patriarchal societies where the women and children don't have any say and lack of resources. So I think with barriers, I think it's easier to find the barriers than it is to find opportunities or get a definition, because the barriers pretty well cut across Africa. I mean, I'm sure most countries will have at least 9 out of 10 of the options of barriers out there. So yeah, that's fantastic. And I think the good thing about it is that as we discuss more and more, and we begin to identify these challenges, and we begin to start looking at how to get funding, and when people understand that by meaningfully engaging the patients, that by actually hearing what they want to do and getting them involved, they will actually put the prices down, the cost will go down. And I think that's why this is so important. These platforms say, look, at the end of the day, involving the patients will actually cut your costs, because you will have advocates who will help you translate. You will have people who are ready to go out to communities. You'll have buy-in because you have your religious leaders and things like that. So it's absolutely fantastic that we can actually sit down like this and discuss this. And the good thing about this is that we are going to get back to everybody after this session in Synapse, all that we've discussed and what the way forward is. We didn't believe for 1 second that we'd finish everything in one session, but it's really exciting that we're really starting to pull all this information and things together. Now I'm going to hand over to Eleanor, who is going to give us some opportunities, because we've talked about why it can't work.
Yeah.
What can we do to make it work? Eleanor, over to you.
Well, I have to thank the erudite, co-creators who, gave us ideas for collaboration from their different constituencies. And, we were looking at access by patients to information. And that word access is packed, and how can we empower them to actually take action? And looking at the mode and means of that information, the language in which, we can get patients and their carers and families to participate meaningfully. So important that we have geographical representation when we are having our meetings. We looked at being intentional when we are sending out our invitations to ensure that constituencies across, for example, we spoke of academia, we spoke of government, we spoke of those in healthcare. How do we ensure that there's good representation? And then we looked at the fact that Africa is peculiar because we have a large youth population. We have a youth bulge. So how can we really bring the youth in? And we had wonderful examples about using art and, even possibly music. And then we looked at how can we then, bear with me as I look at my notes. So how do we ensure that we do not use highfalutin language? When we are looking at patients, we also need to look at their carers. We need to look at their families. We need to ensure also that the credibility of patients' voices is taken into consideration, and looking at mutual accountability. A lot of the times when we're talking of accountability, we're looking at a unidirectional, but it has to be bidirectional, because patients have a strong voice for advocacy. We then also looked at ensuring that those who go out to the communities have special training so that they have the skills in order to be able to communicate appropriately. And lastly, we then looked at how we can further break down, and I would try and look for the specific words that was used in the example. I have so many notes as I am multitasking, but we got examples on patient in building the capacities of patient advocates to move from awareness to strong advocacy, we looked at, also bear with me, looking at cancer patients being able to express their views in a structured way. And then we looked at, I think I will stop there before I begin to try and stand upside down to read my hieroglyphics. And that, there you go. If we are collaborating, we need to make sure that we can communicate and that people like me can read their own writing.
Fantastic, fantastic. Thank you so much for that. And what you mentioned is really important about geographical representation and being intentional about getting the right stakeholders into the room. And it's also fantastic to remind Africa that we do have an extremely young population that can be used. It's about starting young. It's about using tools like music and art and other ways to empower the patients. So that's really a fantastic input from there. And then using simple language. You know, you talk about simple language and using carers and other people within the community to make sure that the patients have a strong voice. And I think I would like to close this on mutual accountability and the fact that patient engagement is a two-way street. We've talked about it throughout this webinar that patient engagement is talking about engaging, mutual engagement, whether it's a two-way street either between us as advocates, between us as the communities, between patients and their caregivers. It's about mutual engagement, mutual participation, and making sure that both sides feel absolutely heard. It's been a really powerful webinar. We're really grateful to every single one of you who have taken time out of your extremely busy schedules to join us here. This is the first of many. We think we've achieved a lot. We've got your juices, I believe, going to join us and come in and make a difference. We are going to consolidate all your insights and share them with you. So please join the patient engagement signups. There is a link. And we just want to thank every single one of you who gave in your questions. You know, we help us to continue the conversation. Please join that signups group. We welcome you to co-create our upcoming Africa sessions. We will get in touch with you, but you have to have joined signups first. Signups is amazing. You're able to share information and things like that. And then we also would like to enjoin you to join our other PEOF activities that are coming up. Next slide. We have an event on the 7th of May. And then, of course, we've got the Made with Patients Awards on the 3rd of June. Please join us for that. And if you have any questions on PEOF Plus, please get in touch with Eleonora, who's on the Synergist. Her details are there. And most importantly, we do have a poll in there. And can you, on a scale of 1 to 10, how likely will you suggest this session to a friend? If you can just help us to answer in the poll. We're really grateful to PEOF and the Synergists, without whom this would not have been possible. All the teams, especially Ozioma and Eleonora, to my amazing co-pioneers. It's been a wonderful journey. I'm so proud to be part of this trip. And we're looking forward to having many more of you join us and really get involved and come up with what really make a difference for patients in Africa, where it's no longer business as usual, where it's no longer tokenism, but we're actually meeting the needs of all the patients along Africa. Thank you so much for your time. We wish you all a fantastic evening and all the best for the rest of the week. Thank you so much.